Today's topic is drug-nutrient interactions. Welcome everyone. Today, we will discuss an important topic in pharmacology and clinical nutrition, drug-nutrient interactions. As healthcare professionals, we often focus on prescribing the right medication or recommending the right diet. However, medications and nutrients do not act independently. They can interact with each other, influencing treatment outcomes and patient health. Understanding these interactions helps us prevent adverse effects, improve therapeutic efficacy, and maintain optimal nutritional status. What is a drug-nutrient interactions? A drug-nutrient interaction is a change in the effect of a drug or a nutrient caused by their simultaneous presence in the body. In simple terms, it refers to any situation in which a drug affects the absorption, metabolism, utilization, or excretion of a nutrient, or a nutrient, food, or dietary supplement affects the absorption, metabolism, action, or excretion of a drug. These interactions can be beneficial when the interaction improves treatment outcomes, harmful when the interaction reduces drug effectiveness, increases toxicity, or causes nutrient deficiencies. Why are drug-nutrient interactions important? Drug-nutrient interactions can lead to treatment failure, drug toxicity, nutrient deficiencies, delayed recovery, increased healthcare costs, poor patient outcomes. These interactions are particularly important in elderly patients, hospitalized patients, critically ill patients, individuals with chronic diseases, patients taking multiple medications. Basic concept of drug-nutrient interactions. The relationship between drugs and nutrients is bidirectional. 1. Effect of drugs on nutrients. Medications can influence nutritional status by decreasing nutrient absorption, increasing nutrient losses, altering nutrient metabolism, increasing nutrient requirements. For example, some medications may reduce the absorption of vitamins and minerals, leading to deficiencies during long-term therapy. 2. Effect of nutrients on drugs. Foods and nutrients can influence medications by increasing or decreasing drug absorption, altering drug metabolism, enhancing or reducing drug action, increasing adverse effects. For example, certain minerals may bind to medications in the gastrointestinal tract and reduce their absorption. Types of drug-nutrient interactions. Drug-nutrient interactions can be classified into three main categories. 1. Pharmaceutical interactions. These occur before the drug enters the body. They usually involve physical or chemical incompatibilities between medications and nutritional products. Example: mixing medications directly with enteral feeding formulas may reduce drug availability. 2. Pharmacokinetic interactions. These interactions affect the movement of drugs through the body. They involve four major processes: absorption, distribution, metabolism, excretion. Together, these processes are known as ADME. 3. Pharmacodynamic interactions. These interactions occur at the site of action of the drug. They affect the response produced by the medication without changing its concentration in the body. Understanding drug-nutrient interactions through ADME. A. Absorption. Absorption is the movement of a drug from its site of administration into the bloodstream. Many drug-nutrient interactions occur at this stage. Factors affecting absorption include food intake, gastric pH, gastric emptying time, presence of minerals, dietary fiber. Example: calcium in milk may bind with certain antibiotics, reducing drug absorption. Result: lower drug concentration and reduced therapeutic effect. B. Distribution. Distribution refers to the movement of a drug from the bloodstream to tissues and organs. Many drugs bind to plasma proteins such as albumin. When nutritional status is poor, albumin levels may decrease. More free drug remains in circulation. Risk of toxicity increases. Thus, malnutrition can significantly influence drug distribution. Understanding drug-nutrient interactions through ADME. Metabolism. Metabolism refers to the chemical transformation of drugs, primarily in the liver. The liver uses enzymes to convert drugs into metabolites. Certain foods and nutrients can increase enzyme activity, decrease enzyme activity. As a result, drug concentrations may either decrease or increase. For example, grapefruit juice can inhibit drug metabolizing enzymes, causing higher blood levels of certain medications. D. Excretion. Excretion is the removal of drugs and their metabolites from the body. The kidneys are the primary organs responsible for this process. Nutritional factors influencing excretion include fluid intake, electrolyte balance, urinary pH. Changes in these factors can alter the rate at which drugs are eliminated. Pharmacodynamic drug-nutrient interactions. These interactions occur when nutrients influence the action of a drug at its target site. They may be synergistic. The nutrient enhances the drug effect. Antagonistic. The nutrient reduces the drug effect. Example: vitamin K can reduce the anticoagulant effect of warfarin. Common examples of drug-nutrient interactions. Example 1. Tetracycline in milk. Calcium binds to tetracycline. Result: reduced antibiotic absorption. Example 2. Warfarin and vitamin K. High vitamin K intake reduces anticoagulant effectiveness. Result: increased risk of blood clot formation. Example 3. Diuretics and potassium. Certain diuretics increase potassium loss. Result: hypokalemia, muscle weakness, and cardiac complications. Example 4. Antacids and iron. Antacids reduce stomach acidity. Result: reduced iron absorption. Clinical significance. Healthcare professionals should review medication history, assess dietary habits, monitor nutritional status, educate patients about food-drug interactions, adjust medication timing when necessary. Proper management of drug-nutrient interactions improves drug efficacy, patient safety, nutritional status, overall treatment outcomes. Summary. Let's summarize today's lecture. A drug-nutrient interaction occurs when a drug and a nutrient influence each other's absorption, distribution, metabolism, excretion, or biological effects. The interaction can occur in two directions: drugs affecting nutrients, nutrients affecting drugs. The most important pharmacokinetic interactions occur through the ADME processes: absorption, distribution, metabolism, excretion. Understanding these interactions is essential for ensuring safe, effective, and patient-centered healthcare. Thank you for watching. If you found this lecture helpful, don't forget to like, share, and subscribe for more lectures on pharmacology, nutrition, and clinical therapeutics.